Can surgery repair torn or enlarged earlobes?
Earlobes can become elongated from the use of heavy earrings that stretch the earlobe. There are also situations of stretching of earlobe piercing. The piercing can also tear, leaving the earlobe split. Many people come in concerned about the appearance of their earlobes, particularly because of the limitations associated with their ability to wear earrings. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I often perform ear cosmetic surgeries for issues like bringing prominent ears closer inward, correcting pixie ear deformities from facelift surgery, and reconstructive ear surgeries such as repairing elongated and torn earlobes. As with all cosmetic procedures, artistry is important. I assess the amount of tissue present and determine the optimal way to restore the appearance of the natural earlobe. This means that there are times when there is so much stretching from age and the weight of jewelry, and earlobe reduction is necessary. Some situations are more straightforward, such as an elongated piercing. In this case, the skin is removed like removing the hole in a donut and then repaired with sutures. After a few weeks of healing, the earlobe can be re-pierced. My assistants and I will look with the patient for the ideal location for a piercing. We place a small gold stud earring to allow the new hole to form, which once fully healed will allow the patient to put an earring of their choosing. Of course, I recommend that the jewelry not be too heavy. Often the skin of the earlobe can be thinned from volume loss due to aging, causing them to become floppy and stretched. In such cases, the application of a cosmetic filler, such as in the hyaluronic acid family, can help augment the lost volume. Cosmetic filler alone can be used if the ear was not significantly elongated. In cases where there is an elongation, then surgical earlobe reduction is necessary. Earlobe reduction is achieved by excising part of the stretched and elongated earlobe and surgically closing it with sutures to restore a more natural and attractive appearance to the earlobe. After healing, cosmetic filler can be injected into the earlobe to add volume for fullness. The principles of earlobe reduction can also be applied in cases where the earlobe, by accident or prolonged use of heavier jewelry, becomes torn and split. The skin from the edges of the torn earlobe are excised, and then the two sides of the earlobe are carefully sutured together. Sutures from earlobe repair or reduction are typically removed after 1 week. Patients can normally return to work the day of the procedure or the day afterwards. These procedures are typically performed with local anesthesia. Earlobe aesthetics are very important to many patients who I see in my practice. Problems ranging from elongated piercings to stretched and split earlobes can be addressed effectively with artistically performed procedures routinely done under local anesthesia. I hope you found this information helpful. Thank you for your question.